Hi, I'm Dr. David Hill, and today we're going to talk about what to do for a rash on a baby's face and chest. So there are a couple of things that commonly cause rashes in this area. The most common by far is eczema. Eczema is an interesting kind of rash because it's worsened by having dry skin, but then it's also a type of allergy. So it's both allergic disease and dry skin disease. The things that help eczema address both of those problems. Now, an eczema rash often is fine little red bumps, and those bumps may itch really badly. They may be on sort of larger red areas as well. You'll often see them on other parts of the body as well, particularly places where things bend, like right here where the arm bends, or behind the knees where those bend. Those are really common places to see an eczema rash. Eczema can affect newborns shortly after birth. So what do we want to do when we see an eczema rash? Well, you want to moisturize using a hypoallergenic moisturizer. I think of moisturizers that don't have any scent, don't have any dye. Vaseline works great. It's a little shiny and kind of sticky looking, but it does work. Aquaphor is not quite as goopy as Vaseline, also works great. Eucerin, Cetaphil, any really thick cream or ointment that does not have dye and does not have scent will be useful here. Another thing you can use is a low-dose over-the-counter hydrocortisone steroid cream. The steroid cream will turn down some of the allergic inflammation. Now, in infants who are 6 months of age or greater, you can also use antihistamines, things like cetirizine, which is Zyrtec, or loratadine, brand name Claritin, will help with the itching and maybe turn down some of that inflammation as well. If these methods don't seem to be doing the trick, you do want to talk to your baby's doctor because he or she may have some other ideas about what the rash is or some other tools for how to deal with it, such as prescription medications that you can't obtain over the counter. Now, another rash that affects the head or the face and the chest in newborns is neonatal acne. Acne occurs. Why would a newborn get acne? Well, a newborn has been swimming in hormones for 40 weeks, and they've got tons of hormones churning around and causing acne for the same reason that teenagers get acne. Now, you don't want to use Strivectin or Retin-A for baby acne, but there is a prescription ointment that's normally used for fungus, ketoconazole, that does seem to be helpful for some babies. The good news with infant acne is it is going to go away over time. Now, telling infant acne from infant eczema can be a bit of a trick, and in a lot of babies both are present, so it's not always obvious and easy to know what you're dealing with. The third thing you're thinking of, particularly on the eyebrows, the ears, and the scalp, is a condition called cradle cap. Now, this isn't usually seen on the face and not on the chest, but cradle cap can coexist with any of the other things. The best thing to do for cradle cap is actually dandruff shampoo, things like Head & Shoulders or Selsun Blue. You want to keep those out of the baby's eyes, but they will help because cradle cap is nothing but baby dandruff. Talking about what you can do for rashes on a newborn or an infant's face and chest, I'm Dr. David Hill.